a child with schizophrenia. She's had schizophrenia for 20 years. She was one of the rare ones who was child onset at 7 years old, diagnosed at 12.
Wow.
But I'm proud to say that she is now in recovery, and she is in her own apartment with her dog, continuing her education and moving forward. So I think schizophrenia, I could talk about schizophrenia all day. I know so much about it. I've learned so much about it. But the fact is that schizophrenia, for some odd reason, is a one word in any medical dictionary that has people running for the hills. They're either afraid of it or they just will ignore it. I've met a lot of people with schizophrenia. I find the younger ones that are early onset, that are just going through their early acute psychosis, are doing much better because our system has changed. It has gone from, let's take these people with schizophrenia and put them in institutions, and we can't do nothing with them because they're erratic. There's no rhyme or reason for it, so there's nothing we can do. That was the old days. The new days were early intervention. We're all about, okay, let's get this quick. Let's make sure they're not in acute psychosis for a very long time. Shorter the time period, better the recovery. Back 20 years ago, that still wasn't the message. The message was schizophrenia is what it is, and that's it. You see what they basically said, this is your daughter, she has schizophrenia, so please grieve, because she's gone. And she'll never get better than this. And although I was young, I am very intelligent. That did not make sense to me. A 12-year-old is not grown up, and there are things you can do. She did have a very difficult time, but I'm a very good advocate, so I never gave up. So I just wanted to let you know that schizophrenia is not as bad as the media makes it sound. We have all been grown up in generations' time. I know when I grew up, I was afraid of anybody in a wheelchair because my mother would go, oh my gosh, don't look at her or don't look at him, you know, and I got afraid. So we got into the habit of being afraid of things that we just don't understand. And schizophrenia is complex, and the researchers and the science is not there to explain it. It is a complex disease, and it is a brain disorder. It's no different than I compare it to the scientists say, okay, well, it's a chemical imbalancement, or it's a mood disorder, or it's this, or it's that. The way I looked at it was something in the brain that was a short circuit. That at some point, a trauma occurred or an overwhelming feeling occurred that triggered it, and the thoughts started racing. And it's a million thoughts, and you're trying to stop that, to be able to take these thoughts and communicate. And the communication is very difficult because you have these thoughts racing in your head, and you have delusions. And that overwhelms the person, physically and mentally, because they see it as a mental illness, but it is a physical illness. Because with this, the person has a hard time to grasp reality. Reality is constantly changing. It's constantly, it's not making any sense. Some on acute psychosis will have delusions, which are false belief. They will believe that it could be as fantastical as the CIA is after me. There's somebody in my brain trying to take my thoughts and put thoughts in, or taking my body parts apart. I mean, they are fantastical, the stories, and the way they think. It's scary at times, and it's bizarre. It is. But when you really look at the process of how it has become a problem for them, you kind of realize that, okay, it's just a matter of slowing down the thoughts. It's a matter of coping. And it is coping. And I think at one time, schizophrenia was a death sentence. You were never going to recover. And today, I am so pleased that you're all here to hear about schizophrenia, because that would never have happened any other time. And it's a sign of the changes, I believe. So I'll give you some fun facts that are research-based, and you can look at you can go on the internet, and there's all kinds of resources for schizophrenia, what it is, what it isn't. It has been agreed that schizophrenia is a biological illness that affects the brain, so it is a brain disorder. And the disorder distorts the senses, so it makes it very difficult for the individual to distinguish between real and what's not real. Schizophrenic individuals have symptoms because of the physical and biochemical changes in the brain. Now, schizophrenia, I know when I was growing up, any word that was too big or I didn't understand, I go, oh my gosh, it's Greek to me. Well, schizophrenia is Greek. That's why it doesn't make no sense to us. So, schizophrenia, the schizo means split in Greek, and the mind, phrenia. So it's split mind. And this is where the false belief of having a split personality came out of, oh, you got schizophrenia, you got multiple personalities. It's not a personality disorder. All they meant to explain was it split the mind from reality, or it's splitting various parts of the thought process. And they believe that it's due to the neurotransmitters. We have dopamine. So the antipsychotics and the medications that you can put on to be able to control some of these symptoms is to attack the neurotransmitters. Antipsychotics are basically to reduce the dopamine so that your thoughts are a lot more slower and that you can basically piece them together. And the other one is moods, which is your serotonin. And serotonin, as you know, you're all professionals, you get it with food, exercise, positive things. So for someone who does suffer from schizophrenia, it is very important for them to manage that illness. And it is a daily struggle for them to manage their symptoms. Medication will only do so much. My daughter, for example, is on an antipsychotic, she's on an antidepressant, and she was on a mood stabilizer. Now they all have their functions, but put together, medication has side effects. So just because it's helping the thought process, or it's making it easier for them to kind of feel like themselves so they can learn to cope, can learn to recover, they're also battling side effects. For one, my daughter's off the mood stabilizers because there wasn't any that wouldn't cause seizures. She would get seizures, she would be disabled in her hand, she would not be able to open it, different things like that. So when you're dealing with someone with schizophrenia, it's just not the complex symptoms that they have, it's also what the medication is doing for them. And the problem with a person with schizophrenia, they are very much trying to not let that illness come out. That's part of their coping skills. They say, okay, well, I'm good, I'm doing this, I'm talking properly, but then if they get a little bit of stress, or they get a little bit overwhelmed, or they get in a situation where their anxiety goes up, then all of a sudden, schizophrenia is a little bit more visible. And that makes them panic, because, oh my gosh, I just outed myself. What's going to happen? And that is the worst fear for anybody with schizophrenia, is to be having people be afraid of them. Because I've met so many of them. And I was saying to Lynn that I just do this recovery journey program that we do for people with schizophrenia, and I have 2 participants, and they're young, and then their last session is tomorrow, and they're now empowered to be able to cope. And now tomorrow they're going to do their action plan, their personal action plan, and they're already attached to resources in their community to move forward in the road to recovery. And the fact is that recovery is not just possible, it's expected now. But it also starts with the person. The person has to take personal responsibility for their life. But that's easy. You just basically treat them as a person and say your life has purpose. I had those 2 young people in my course, and not one person ever told them that they were a person and they had a purpose. And one has beautiful poetry, and the other one could read a manual and put anything together. We all have our own skills, and people with schizophrenia, although their thoughts are a little confused, or they present themselves a little bit more awkward, they have a little bit more confusion, they need to be communicated a different way, doesn't mean that they do not have purpose. So that's one of the things that I think we all would like the mental health field to be going in that direction. They have changed their policies in different areas with the recovery-oriented practices, putting the person in front of the care and say, what do you want? Well, nobody's ever asked them that before. They just gave them a plan and said, this is what you need to do, and do it this way. Well, now we're hearing from them and saying, you know what, I did what they wanted me to do. I did exactly what they wanted to do, but it didn't work. Didn't work for me. So there are ways to communicate with people with schizophrenia, and I'll get that in a moment. So I guess with schizophrenia, the risk of suicide for people with schizophrenia is much higher than found in the general population. 40 to 50% of people with schizophrenia will attempt suicide at some point, and approximately 10% of individuals with schizophrenia do commit suicide. And a lot of them are young. They're in their teenage years. They're in the point where they are trying to find their identity, their brains are in development, and they are struck with schizophrenia, and it gets just too much. Because sometimes the medication doesn't take away the voices, or it doesn't take away the delusions, or the night terrors, or the things that are affecting their brain. And we need to be able to be more responsive to them, to be able to give them tools. There are so much research. I know the research is maybe 1/10 of any other illness for schizophrenia. We should be doing a lot more research into what works and what doesn't work. But what I find now, and you will see it on TED Talks, you'll see it on the internet, of people that are coming forward and self-identifying and saying, you know, I can live now without medication. Well, that was not acceptable in any medical field, that you're got schizophrenia with no medication. No, that's not going to happen. But there are some people that do and are able to do that. So that is a great advancement in our understanding of schizophrenia. Some researchers believe that schizophrenia is really a group of related illnesses like cancer. So if you say you have cancer, the person says, okay, well, what kind of cancer? Breast cancer? Be more specific. With schizophrenia, it seems like it's more an umbrella for a whole bunch of symptoms. So if you looked at the symptoms, even with psychosis, for example, that is basically that's what you're dealing with, is a psychosis. Once you get the psychosis under control, and that can happen with anybody with dementia, with Alzheimer's, Huntington's disease, they can all be affected by psychosis, where they go into their mind, they withdraw, they have disturbed sleep, then their thoughts are a little bit more disorganized, fantastical, they live in their head. Well, just because you're a patient with Alzheimer's have psychosis doesn't make them have schizophrenia. When someone is diagnosed, my daughter was diagnosed with psychosis, and then eventually became schizophrenia. And I asked, well, how did it go from psychosis to schizophrenia in such a short period of time? It's because that if you present with the symptoms of psychosis for more than 6 months, and there's no other physical illness to explain it, it becomes chronic psychosis, which is schizophrenia. So you want to change the word schizophrenia? I don't like it. It's Greek. Chronic psychosis is basically what it is. And the medications, the antipsychotics nowadays are much better than they were in the older days, because it does specifically affect the neurotransmitters, where the other ones kind of went in there but didn't really specifically went and reduce that dopamine or increase that serotonin. It just kind of went into the brain, and haphazardly it might help some people, but at some point we needed newer drugs and newer therapies, and now we do. But also when you look at the research and you look at you go into the journals and the studies, which I have, I just got obsessed over it, you find out that none of these medications really are good long term. They may give you 2 years before a relapse. Oh, some may even give you 5. But if you dig really deep in it, some antipsychotics side effects is psychosis. So with schizophrenia, schizophrenia or any mental illness, it's all trial and error. We don't know what's in our minds. We don't know how the brain is absolutely fascinating, I have to say. And you never know. It's just a matter of treating the person as a person, I guess. That was the key message that I had received from anyone that I spoke to with schizophrenia. I said, you know what, it's not so bad when I'm well. But when I'm unwell, I'm not even a person. They don't even look at me. They don't even treat me. They don't even care what I have to say. They know best, and we just do what they want us to do. So this is the reason that a lot of people with schizophrenia will not go get the care they need, because of the mistrust, of the false beliefs that it's a shame and a guilt, and the discrimination of just saying that you have schizophrenia. It is discriminated in our society, and we need to have more public awareness that these people aren't our enemy. They're not violent. They're more vulnerable to violence than they are to be violent. A lot of the people with schizophrenia are in hospitals, in long-term hospitals. You find them in jail, you find them in the homeless, because they have gone to the point where they have been so discriminated, and the care was not the same as if you went in with cancer. And that's the reason I became such an advocate, was because I was getting no help. As a mother with a child with schizophrenia, I was getting closed doors, and go see this person, go see that person, and I'm thinking to myself, oh my gosh, after 250 calls, I'm thinking, wow, it would have been a lot easier if she would have been diagnosed with cancer. That's an awful thing for a mother to say. But the fact was, my family didn't believe. They were outed. I was out of my friends. All of a sudden, even my husband didn't understand. And I'm here by myself thinking, well, come on, it's an illness. It's not something new. Why are we so afraid to talk about it? Why are we so afraid to self-identify? I have fibromyalgia. I have limitations. I also, because of my experience with schizophrenia, I've got anxiety and depression and all kinds of mental illnesses. But we all have something. We all have anxiety. We all have depression at times. One psychiatrist told me we are one trauma away from being all schizophrenics. There you go. When you look at the symptoms and you look at what they're doing and the overthinking and the way that we as people every day deal with our issues and our problems, it's no different than how they deal with it. It's just for them, it's a lot more severe because it affects their functioning. Where we have some resilience, our brains are not scrambled. We don't have to piece it in like dyslexic and try a different way of putting the blocks together. We don't have that, but we have the daily stresses. So I think it's very important to have effective communication skills. And you all work in a nursing home, so the communication skills for someone with schizophrenia is no different than any of your other clients. They want the same things that you do. So I do have some communication do's and don'ts, and it's basically to communicate your needs. You want to be assertive. But assertive means that you state your wishes directly and honestly. And it's not usually how you say it that matters to them, it's how you say it. Because they're already the worst critic. They're already in their mind saying, I'm not worth anything, I'm nobody. They have this critic that is loud. We have our own critics, but we can kind of put them aside on the back burner. Say, yeah. Maybe today I have a bad hair day, but to them, it's so hard for them to communicate that we found that it was best to keep it short, to keep it brief. And I know it doesn't sound right, but a lot of repetition. Because I know for myself, my daughter, I got so used to doing it that I didn't realize that I was still doing it after all these years, is that when she has a problem, she obsesses over this problem. So I keep saying, I keep repeating the same things over and over again. And then I get some rest and I keep doing it. And I just do it out of habit. And my friend said, oh my gosh, you said that just the other day. Exactly. I said, word for word, I could quote you. I thought, I'm still doing that. But I did it because it worked. At some point, something I said registered. It might not have registered the first 15 minutes of my conversation, but maybe on the third day, she got it. And it worked. I know that even for appointments, if you take the person for appointments, they're going to zone out. They can't, it's information overload. I know I took my daughter to an appointment with her worker first day. It's an hour for this visit. And she said after about 10 minutes, I zoned out. I said, I couldn't tell you what she said. So it was good that I was there to get the information and help with that, because she would have sat there for an hour and not understand a word, because she was just overwhelmed. It was anxiety took over, and so if you say, well, geez, I just said that, I just repeated that, can't you get this? That's not helpful. It's not helpful to anyone. And I think that's where, with someone with schizophrenia, if you do get, the older generations are going to be coming into homes, because I do have some that are 80 that are taking care of their 60-year-old and have been taking care of them at home for 40 years. Well, this 80-year-old is going to die eventually. And these are the people that are going to come to your home. And you have to imagine that they have been isolated from the general public for years. They may have learned habits or not being able to communicate. And one woman is still washing and brushing her daughter's hair. So they can't even do some of the activities of daily living. So they are going to come into your home, and change is going to be huge for them. So I would just hope that you provide them a welcome, a very therapeutic and be very patient with them, because you know what? At the end of the day, once you actually get to know these people, they're actually pretty great. They are very good people. They are kind. They have been bullied. They have been discriminated. They have had stigma. They've had people tell them that they were crazy and nuts and should be in an institution or shot, or all the mean things that happen. And they still have a smile and go out and want to help people and do good things after all that. So thank you. I have some resources here. I will leave them if you want to make copies of the Facts of Schizophrenia Communication Scales. I'll leave that as well. I got some brochures. And we also have a book that we offer. It's called Schizophrenia Rays of Hope. It's a reference manual for families and caregivers. I'm telling you, I got this 20 years ago. It was like the Bible. Because I knew nothing about schizophrenia or what to do. And this was step by step telling me, first and foremost, it wasn't my fault, and showed me how to help my daughter and my kid.
I have a question. Do you ever find that schizophrenia ever goes undiagnosed or gets like different treatments, like sometimes being like bipolar or just being depression? Does that happen lots?
It does. It does get misdiagnosed. I find that it depends on, well, it depends, it's because of the psychosis. It depends on, because basically, you're not going to come in and get your first assessment and be diagnosed with schizophrenia. You're going to be diagnosed with whatever symptoms you have.
Yeah.
So if it's manic, if you're manic or you're depressive, well, then you're going to be put into some kind of mood disorder. I find there is going to be a lot of misdiagnoses on all the mental illnesses.
I know I have a cousin who was diagnosed with bipolar probably about 14 years ago, and I feel like he's more on the side of schizophrenic than he is on the side of bipolar.
Yes.
But because he's got a doctor, that's just so determined that it's bipolar and it's nothing more. But when you spend time with him, from all the studies I've done on schizophrenic, you see that side, that that's what it is more than it is bipolar. It's not just your up and downs, there's more to it. And I was just curious if it is commonly misdiagnosed.
And it is commonly misdiagnosed, and I think a lot of it is because some doctors just don't want to, because of the discrimination. of it. Because I know some people that don't even want to be diagnosed
Yeah.
and are suffering because they know that they're going to be labeled.
Yeah.
And once you're labeled schizophrenia,
It's a label that
it's a label that you have to
Yeah.
live with and overcome. Where bipolar, it used to be manic depressive.
Yeah.
So manic depressive did have the stigma, the discrimination, just like schizophrenia. Call it bipolar. Oh, it's different. People don't know what that is exactly. So
Yeah.
it's not as bad.
And you just look at it with bipolar, you have a mood swing, it's like up or down, like you're either having a really high or a very low, but like I said, it's just when you hang out with them or spend any time with them, you can really see that it's not just a really high or really low, you can see the differences, like, because I've done my studies on schizophrenia too, just from being around them or spending time, or just for my family side of things, and I've seen like just those different things you can see, and then when you're with them or you're spending time, it's like, okay, the types, like you said, the personalities, that he just gets all closed off and he just doesn't want to be around people, or he gets into his own little world, and I just see all those things. So.
Yeah, so that would probably be more leaning towards schizophrenia. But like I said, some doctors don't want to diagnose it.
Yeah.
I have seen some people with schizophrenia that I thought were more schizophrenia that were just being treated with depression.
Yeah.
And I thought that was unfair because
Well, they're not getting the right treatment.
They're
not
not.
getting the right medication or the right, in the sense of what they need to be instead.
exactly.
Yeah, because I know he lives in a basement and he secludes himself too. Like he's not one. So I was just curious because like I deal with that. So yeah.
Yes, exactly. Well, that I would say is more schizophrenia than bipolar, definitely.
I know one of the things